couldn't be here today, so I'm going to read from her notes. I'm an MD PhD student here in the Department of History. I'm a historian of medicine. So I didn't actually need the notes to tell me that Avicenna is the Latinized name of a Muslim physicist, astronomer, mathematician, and physician. So we'll get there. Today's speakers are Dr. Irfan Ahmad and Donna Camp. Dr. Ahmad is president of the Avicenna Community Health Center. And the center is named for Ibn Sina, who is considered a father of modern medicine, particularly for his discovery of the contagious nature of infectious diseases, the introduction of quarantine to limit the spread of diseases, and the introduction of experimental medicine and the use of clinical trials and efficacy tests. It is the work of the Avicenna Community Health Center to recognize his excellence in medicine and promote a healthy lifestyle in our community through health screenings and education. As such, in the spring of 2009, a group of community members from the Muslim community got together to address a pressing need: inadequate health care coverage for the uninsured and underinsured members of the Champaign-Urbana community. Now, when he's not working as the president of the Avicenna Center, Dr. Ahmad's research interests involve bio-nanotechnology, nanomedicine, biosensors, agricultural machinery design, and precision agriculture. And on that note, I can introduce to you Donna Camp. She is director of the community services for the Wesley United Methodist Church in Urbana and director and co-founder of the Wesley Evening Food Pantry. The ultimate goal for the Wesley Evening Food Pantry, as their website explains, is for everyone in our community to have enough food to eat, resulting in the need for the pantry. And until that goal is reached each month, the Wesley Evening Food Pantry provides a week's worth of food to assist people through to the end of the month when paychecks and food stamps may be low. The food pantry is scheduled in the evening to accommodate work and school responsibilities. It also respects self-determination as participants select their own food choices that match their family's needs. It also provides regular resource centers for information, referral, and health consultation, and it trains volunteers regarding both procedures and the operational values of respect, access, and choice. Finally, the pantry addresses the root causes of hunger, for our particular set of clients. Donna's public sector career began as a master control room board operator at WILL Radio, and since that time she has counted chickens before they were hatched as a Peace Corps volunteer in the Caribbean, led a national program which provided low-income taxpayers with free electronic filing in the pre-internet days, if you can remember those, and she worked with the National Head Start Bureau to recruit doctors to provide free services through the Head Start program. She has also designed innovative software to identify at-risk populations for the Centers for Disease Control in Atlanta, Georgia. And with that, I would like to ask you to join me in welcoming our accomplished and inspiring speakers.
I did not know this was me, but I think it was Donna Camp, the speaker. Thank you. Good afternoon. I am Irfan Ahmad, and thank you for inviting me and YMCA for coordinating this forum. I've had the opportunity of attending these forums a number of times, and indeed great avenue for airing our thoughts and ideas. I would make a kind of a speech, so to speak, but I also have slides which are running, will be running in the background, which I hope will not be a distraction. I had timed them, but they're not synchronized with my talk. So, as much as I would like for you to listen to me, I don't want you to be distracted by the slides by themselves. Before I go any further, I would like to say that our thoughts and prayers are for those victims in Boston and in Texas, innocent victims, and we pray for their families and those who have lost their lives. With that, I would like to bring up my slide and left with one while I speak. $multi-billion in healthcare expenditure, a technology-driven healthcare infrastructure, which is envy of the world, where from royalties to leaders to ordinary people come to be treated for complex and chronic diseases. The cost of long-term healthcare in nursing homes and assisted living sites has increased dramatically compared with the cost of in-home care, according to a recent New York Times report. Yet, approximately 12 million do not have access to health care. And yes, you guessed it right, we are talking about the United States. When I made this observation about 12 years ago, just coming out of graduate school, of course I am not the only one who recognized this sad fact. Therefore, something had to be done. But where should one start? With a background in agricultural engineering and the only knowledge of medicine or healthcare I had was on being a patient. But a patient was a patient in graduate school and during more job periods, and then later was covered under employment. This and other disparities, such as homelessness, were brought home further when I worked on the National Cancer Institute funded project at the UFI on cancer nanotechnology, where during the meetings I heard firsthand heart-wrenching and painful stories from patients and patients advocates of the existing healthcare disparities and the pain and misery caused by cancer, and how patients had to make a decision between food on the table or medication. This was not a comforting realization, but a rude awakening, compared to the fact that the US had sent people to the moon several times, but had not been able to grapple with the needs of the marginalized and the disenfranchised in our communities. Something had to be done. And inspired by the chronic injunction that if anyone would save a life, it would be as if he saved the whole humanity, and the prophetic saying that he is not a believer who eats his fill while his neighbor remains hungry by his side. Some of us gathered together at the local Islamic Center, CIMIC, and decided to do our part. We decided to launch a free healthcare clinic which would provide both preventive and curative healthcare to our neighbors, the underinsured residents of Champaign County. The formative group included physicians, engineers, other professionals, graduate and undergraduate students, including medical students, interfaith communities, and general community members. Indeed, it was a tall order with no experience. However, we took a systems approach and conducted research of existing similar clinics locally and in the US. We also visited some of these clinics, including the first among many Ummah Clinic in Los Angeles, the Muslim Maryland Clinic, and Iman Clinic in Chicago. We talked to and received the launch assistance from the Champaign County Christian Health Clinic and the then Hope Clinic, the Francis Nelson, and the Champaign County Healthcare Consumers and others in the community. All those systems integration and entrepreneurial techniques which we had learned during grad school and in professional pursuits at the University of Illinois came handy. With 19,000 uninsured residents in Champaign County, the number jumps to 54,000 if you count the uninsured or the underinsured. This having become more pronounced due to the recent economic downturn plaguing the US. And according to a 2008 report from the Kaiser Family Foundation, 1% increase in the unemployment rate increases Medicaid and state children's health insurance program enrollment by 1 million and increase the number of uninsured by 1.1 million. These are telling statistics. From the onset, we recognized that merely providing preventive healthcare will not be enough unless lifestyle changes are promoted as part of the preventive healthcare framework. Therefore, we not only assembled an impressive team of primary healthcare physicians, a scarce commodity by itself in the age of specializations, but also added a preventive healthcare team